The National Dairy Farm Program recommends 6 best practices when it comes to dairy farm management regarding training, standard operating procedures, and record keeping. The dairy has a documented veterinarian client-patient relationship. That means that 1. The veterinarian has assumed the responsibility for making clinical judgments regarding the health of the patient, and the client has agreed to follow the veterinarian's instructions. 2. The veterinarian has sufficient knowledge of the patient to initiate at least a general or preliminary diagnosis of the medical condition. This means that the veterinarian is personally acquainted with the keeping and care of the patient by virtue of a timely examination of the patient by the veterinarian or medically appropriate and timely visits by the veterinarian to the operation where the patient is managed. 3. The veterinarian is readily available for follow-up evaluation or has arranged for veterinary emergency coverage and continuing care and treatment. 4. The veterinarian provides oversight of treatment, compliance, and outcome. And 5. Patient records are maintained. Take time to train and educate animal caretakers about animal care expectations and animal well-being policies. Thorough and regular training of employees is vital to exceptional on-farm animal care. As part of the National Dairy Farm Program, documentation of such training exists for new and existing animal caretakers at least on an annual basis. A best practice is to train new animal caretakers on animal care promptly after hiring. Also, animal caretakers should be cross-trained for all situations they may encounter. Standard operating procedures, or SOPs, are written instructions for various aspects of animal care on the dairy. As part of the farm program, written SOPs are readily available and in many cases posted in the native languages of personnel assigned animal care responsibilities. The SOPs provide enough detail to ensure that all animal caretakers empowered with a specific animal care assignment can routinely and consistently perform their animal care duties. As a best practice, SOPs are reviewed at least annually and updated as necessary. Emergency contact information is readily available to address animal care needs arising from unique circumstances such as a fire or natural disaster, equipment failures, and power failures. A best practice includes arrangements for animal caretakers or temporary help to cover emergencies, weekends, holidays, and unexpected absences of assigned animal caretakers. Animal caretakers are informed of animal care expectations and qualified to perform assigned duties. Posting the names and telephone numbers of emergency contacts in a prominent place in the animal facility in employees' native languages is necessary to speed communications in an emergency. When it comes to identification and record keeping, each animal is permanently identified and an effective record-keeping system in place for animal care and management decision-making. Animal identification and record-keeping are critical for making important management decisions about feeding, grouping, selecting, treating, breeding, and culling an animal from the herd. In addition, food safety, foreign animal disease threats, and bioagro-terrorism concerns make premise and individual animal identification a necessity. Under the U.S. Department of Agriculture Animal Disease Traceability Rule, all dairy cattle females, regardless of age, and all male dairy cattle including dairy steers that are born after March 11, 2013, are required to be officially identified by a device or method approved by USDA prior to interstate movement. Additionally, all dairy cattle moving between states must be accompanied by an interstate certificate of veterinary inspection or other documentation as agreed to by the receiving state. The National Dairy Farm Program recommends using 840 RFID ear tags, which the USDA recognizes as an official identification device for the lifetime of an animal. The farm program recommends that a specific milking routine, procedures, and actions are followed to ensure cow comfort and well-being. Many studies have found that farms with quiet, confident animal caretakers have higher milk production. Thus, all animal caretakers should behave in a calm and controlled manner. There are a number of best practices in the parlor. Gates and restraining equipment operate smoothly, quietly, and safely. Waiting time is minimized for each milking. The preparation routine that signals the beginning of milking should be pleasant to the cow and consistent. The routine should include checking for abnormal milk and thorough cleaning and drying of the teats. Teat ends are periodically inspected to identify any problems. Avoid medical examinations or unpleasant experiences from being associated with the place of milking. The pre-milking holding area on farms with milking parlors is the place of highest animal density on the farm. It's important that prevention of injury be considered in the design of the holding area's flooring, space, sidewalls, and entrance to the milking parlor. Moderation of temperature extremes by use of fans, sprinklers, or other technology ensures animal comfort in the holding areas and the milking parlor. Milking equipment is regularly maintained and checked for vacuum level, pulsation rate, and pulsation ratio. Equipment is also checked for stray voltage if unusual behavior is exhibited or milk production drops. To prevent disease transmission, milking equipment is maintained, cleaned, and sanitized.